If you are over 60 and your shoulder hurts, your first instinct may be to stretch it right away. Maybe you pull your arm across your chest. Maybe you reach for a doorway stretch and hope it loosens up. But here is the problem. That stretch may be the exact reason your shoulder is not getting better. A lot of adults over 60 are told to just stretch it out, but shoulder pain is not that simple. Not all shoulder pain comes from the same cause. In some cases, the wrong stretch can keep the joint irritated, make lifting your arm harder, and turn a small problem into months of daily discomfort. That is why in this video, we are not going to guess. We are going to test first. Think of your shoulder like a hinge and muscle system that has to work smoothly every time you reach up. Get dressed, wash your hair, lift groceries, or reach into a cabinet. If one part is irritated, weak, or not moving well, forcing a deep stretch does not fix the real problem. It can actually make that sensitive area angrier. For some people, the issue is that the shoulder is getting pinched in a certain range. For others, the problem is weakness in part of the rotator cuff. And for some, the deeper problem is poor support from the muscles that help keep the shoulder stable. These problems can feel similar, but they do not respond to the same exercise. So instead of using a one-size-fits-all routine, we are going to use a simple test, do not guess approach. I will walk you through 3 easy shoulder checks: the side lift pinch, the empty can, and the outward turn. These are not random movements. Each one helps reveal a different reason your shoulder may be hurting. And once you know which movement matches your pain, you can choose the exercise that actually fits your shoulder. That matters even more after 60, because the goal is not to push through pain. The goal is to protect the joint, calm irritation, and help you get back to normal daily movement safely. Things like reaching for a plate, putting on a shirt, fastening a seatbelt, or sleeping more comfortably at night. So before you stretch your shoulder again, let us make sure you are treating the right problem. By the end of this video, you will have a much clearer idea of what your shoulder may be struggling with, what type of movement to avoid, and which gentle exercise may help you start moving with less pain and more confidence. Now let us start with the first shoulder check. This one is called the side lift pinch. In the medical world, it is often called the painful arc. But do not worry about the name. What matters is what your shoulder feels like during the movement. Try this with me. Let your arm rest by your side. Keep your hand relaxed with your palm facing down. Now slowly lift your arm straight out to the side. For some people over 60, the movement starts out feeling fine. But then, right around shoulder level, there is a sharp catch, a pinch, or a sudden pain that makes you want to stop. And here is the interesting part. If you continue a little higher, sometimes that pain eases off again. If that happens, that is an important clue. Think of your shoulder like an elevator with a very tight doorway. When your arm is down, there is enough room. When your arm gets all the way up, the position changes and the space opens again. But in that middle range, the space gets tighter. That is where the shoulder can start to pinch. This is why some adults notice pain during simple daily tasks, not just exercise. You may feel it when reaching into a cabinet, putting away dishes, reaching for a shirt, or fastening your seatbelt. If that middle range pinch feels familiar, your shoulder may be asking for one thing first: more space, not more force. So instead of stretching aggressively, we want to calm the area down and help the joint move more comfortably. Here are 3 gentle moves that can help. 1, pendulum swing. This is one of the safest and easiest ways to begin, especially if your shoulder feels irritated. Stand next to a sturdy table or counter and lightly support yourself with your good arm. Lean forward a little and let your sore arm hang down loose and heavy. Now do not lift the arm. Do not force anything. Just gently move your body so the arm swings a little, forward and back, side to side, or in small circles. The key here is to stay relaxed. Let gravity do the work. This movement can help take pressure off the joint and give irritated tissues a chance to settle down. For many adults over 60, this feels much better than trying to muscle through a stretch. 2. Table slide next is the table slide. Sit at a table and place a towel under your hand so it can glide easily. Rest your sore arm on the towel, then slowly slide your hand forward across the table. Only go as far as feels comfortable. No forcing, no sharp pain. What makes this move helpful is that the table supports the weight of your arm. That means your shoulder can practice moving without having to work so hard to hold the arm up in the air. This is a very good option if lifting your arm normally feels pinchy, weak, or stiff. 3. Shoulder blade squeeze. The third move looks simple, but it matters more than most people realize. Sit or stand tall. Now gently draw your shoulder blades back and slightly down, as if you are trying to tuck them into your back pockets. Do not shrug. Do not squeeze hard. Just a gentle reset. Your shoulder blade acts like the base of the whole shoulder system. If that base is rolled too far forward, the arm often does not move as smoothly. But when the shoulder blade is in a better position, some people notice the pinch feels smaller right away. It is a small adjustment, but it can make a big difference. What to remember? If the side lift pinch matches your pain, your first goal is not to push harder. Your first goal is to create a little more room and a little less irritation. Start gently, move slowly, stay out of sharp pain. For many adults over 60, these 3 movements are a much smarter place to begin than deep stretching or repetitive overhead motion. And once this first pattern starts calming down, everyday movements like reaching into a cabinet or getting dressed often start to feel easier too. Now that we have checked for a pinching problem, let us talk about a different reason your shoulder may hurt. Sometimes the issue is not lack of space. Sometimes the issue is lack of support. Have you ever reached for something on a high shelf and felt like your shoulder just did not want to cooperate? Or maybe lifting your arm to wash your hair, put on a shirt, or reach into a cabinet feels weak, shaky, or surprisingly hard. If that sounds familiar, the problem may not be that your whole shoulder is failing. It may be that one small but very important muscle is not doing its job well. That muscle is called the supraspinatus. You do not need to remember the name. Just think of it as the small helper muscle that gets your arm started every time you lift it. It is like the starter motor in a car. When that small part is irritated or weak, the whole shoulder can feel unreliable. That is where our second check comes in. The empty contest holds your arm out in front of you, but angle it slightly off to the side, halfway between straight forward and straight out to the side. Now turn your thumb down like you are pouring out a can. Then simply see how that position feels. If holding that position causes pain, weakness, or a feeling like your arm wants to drop, that gives us another important clue. It may mean this small support muscle needs help, and this is where many people make a mistake. When something feels weak, the natural reaction is to push harder. Use more effort, do more reps, lift more. But with an irritated shoulder, especially after 60, that approach often backfires. This is not the time to force strength. This is the time to rebuild it gradually. We want a gentle reset, a smart reboot. 1. Wall slide. The first move is the wall slide. Stand facing a wall and place your forearms on the wall in front of you. From there, slowly slide your arms upward as far as you comfortably can. Then slide them back down. Go slowly, stay controlled, and stop before sharp pain begins. This movement helps your shoulder practice lifting in a supported, guided way. It gives the muscles a chance to work without the joint feeling overloaded. If your arms start to peel off the wall or your shoulders tense up too much, You have probably gone a little too high. That is okay. Just stay in the range where the movement feels smooth and manageable. For many adults over 60, this is a much safer way to begin rebuilding shoulder strength than jumping into heavier exercises too soon. 2. Isometric wall press. Once that feels comfortable, we move to one of the most helpful exercises in this section, the isometric wall press. Stand sideways next to a wall with your sore shoulder closest to the wall. Bend your elbow to about 90 degrees. Then gently press the outside of your arm into the wall as if you are trying to lift your arm outward, but the wall is stopping it. Now here is the part that really matters. Only use about 30% of your effort. That may sound too easy. It may even feel like you are barely doing anything. But that light pressure is exactly the point. We are not trying to overpower the shoulder. We are trying to remind it how to work again without irritating it. This type of exercise helps wake the muscle up while keeping the joint calm. Hold for about 10 seconds. Repeat 5 times. And do it gently. Why light effort works better? Think of it like charging an older battery. If you slam it with too much power too fast, it does not respond well. But if you recharge it slowly and steadily, it starts working again. That is the same idea here. Your shoulder may not need more force right now. It may need better timing, better support, and a little more confidence. That is why patience works better than intensity. If this test matches your pain, the goal is to give that small support muscle a safe way to come back online. Over time, as pain settles down, you can slowly increase the pressure a little more. Maybe from 30% effort to 40%, then 50%, as long as it still feels controlled and does not flare things up. What to remember: if the empty can test feels weak or painful, do not panic. It does not automatically mean something is badly damaged. It may simply mean one part of your shoulder is underperforming and needs the right kind of support. Start with gentle, controlled movement. Use light effort. Let the shoulder rebuild trust. For many adults over 60, this gradual approach works much better than pushing through pain and hoping the shoulder catches up. And when this small muscle starts doing its job again, simple daily tasks often feel easier, steadier, and less frustrating. So far, we have looked at 2 common problems. First, a shoulder that feels pinched in the middle of the lift. Second, a shoulder that feels weak when it tries to get the arm moving. But there is one more important piece of the puzzle that many adults over 60 never hear about. It is the group of muscles on the back of the shoulder that help rotate your arm outward and help keep the shoulder in a better position as you move. These muscles are often overlooked, but they matter a lot. The outward turn test here is a simple way to check them. Bend your elbow to about 90 degrees and keep it tucked gently against your side. From there, try to turn your hand outward. You can press lightly into a wall or even use your other hand for a little resistance. Now notice what happens. If that movement brings on a sharp ache, a deep discomfort, or pain along the back or outside of the shoulder, that gives us our third clue. And this is the point where many people do the wrong thing. When the back of the shoulder feels sore or tight, the natural reaction is to stretch it. People often pull the arm across the chest or do deep stretches thinking the muscle just needs to loosen up. But very often that is not the real problem. In many cases, those muscles are not truly tight. They are tired. They are overworked. They have been trying to hold the shoulder together for too long without enough support. Why this happens? Think of your shoulder like a tug war. On the front side, you have stronger muscles from the chest and the front of the shoulder. Those muscles tend to dominate, especially after years of everyday habits like sitting, driving, reading, typing, and reaching forward. Over time, that forward pull can become the default position. The The smaller muscles on the back of the shoulder are the ones trying to pull everything back into balance. But if they have been losing that battle for a long time, they can start to feel sore, weak, and strained. That is why stretching them harder is not always the answer. It is a bit like pulling even more on a rubber band that is already stretched too far. What that rubber band usually needs is not more length. It needs some strength and support so it can start pulling back again. Step 1, assisted rotation. The first move here is assisted rotation. Take a stick, cane, broom handle, or anything similar. Keep both elbows tucked close to your sides. Then use your stronger arm to gently guide the sore arm outward. This is not a forceful stretch. This is a gentle assisted motion. You are simply showing the shoulder that it is safe to move in that direction again without asking the sore side to do all the work on its own. Move slowly, stay relaxed, and stop before sharp pain. For many adults over 60, this feels much better than aggressive stretching. Step 2, isometric outward press. The second move is the one that often makes the biggest difference over time, the isometric outward press. Stand next to a wall with your sore side closest to the wall. Keep your elbow bent and tucked gently against your side. Then press the back of your wrist into the wall as if you are trying to rotate your hand outward. But do not push hard. Just like in the last section, use only about 30% of your effort. That gentle pressure helps wake up the muscles on the back of the shoulder without overloading the joint. It gives them a chance to start working again in a controlled, safer way. Hold for about 10 seconds. Repeat 5 times. And keep the effort light and steady. Why this matters so much, this is one of the biggest mistakes people make with ongoing shoulder pain. They keep stretching the back of the shoulder over and over, but the area never truly feels better. That is often because the muscles do not need more pulling. They need better support and a chance to get stronger in a calm, gradual way. Once those muscles begin to do their job again, the shoulder often feels more centered, more stable, and less irritated during everyday movement. That can make a real difference when you are reaching into a cabinet, putting on clothes, lifting light items, or simply trying to move the arm without that constant ache. What to remember, if the outward turn test matches your pain, do not assume the back of your shoulder just needs a bigger stretch. Often, it needs the opposite. It needs gentle movement, light support, and gradual strengthening. For many adults over 60, this is the missing piece. And once they stop overstretching that sore area and start rebuilding support instead, the shoulder often begins to feel more stable and much less sensitive. Now that you have a better idea of what your shoulder may be struggling with, let us turn this into a simple, real-life plan. And first, if you are thinking, what if more than one test bothered my shoulder? Do not worry, that is actually very common. For many adults over 60, shoulder pain does not fit neatly into just one box. You may have a little pinching, a little weakness, and a little poor support all at the same time. These patterns often overlap. So for your first 7 days, keep it simple. Start with the test that felt the most like your everyday pain. If your shoulder pinches when you reach up into a cabinet or lift your arm out to the side, begin with the space-making exercises from the first section. If your arm feels weak, shaky, or like it just does not want to lift, begin with a gentle strength reboot from the second section. If the ache shows up more in the back or outside of the shoulder, especially when turning the arm outward, focus on the support and stability work from the third section. You do not need to do everything at once. You just need to start in the place that matches your real problem best, the rule that matters most for the next week. Remember this one rule: patience works better than intensity. A lot of people have been taught that if an exercise is not hard, it is not helping. But with a painful shoulder, especially after 60, that mindset often makes things worse. Right now, the goal is not to push through pain. The goal is to calm the joint, restore trust in the movement, and help the shoulder work again without flaring up. That is why the 30% effort rule matters so much. That light effort may feel small, but it gives your shoulder something very important, a sense of safety. And when the shoulder feels safer, the body is less likely to tighten up, guard, and make every movement feel stiff and painful. Keep it short and consistent. Think of recovery like building a small bridge. You do not build it all at once. You build it piece by piece. That is how shoulder recovery often works too. A few minutes of the right movement once or twice a day is usually far more helpful than doing a long workout once a week and irritating the shoulder all over again. For many adults over 60, even 3 to 5 minutes each morning can be a very good place to begin. Small steps, steady effort, no forcing. That is often what leads to the best progress. When to stop and get checked. Now, even though these exercises can help many common shoulder problems, there are times when you should stop and get medical advice. Please do not try to work through it on your own if your pain started after a fall or injury, your shoulder feels like it may slip out of place, you cannot lift the arm at all, you have strong night pain that keeps waking you up, or the pain keeps getting worse instead of better. In those situations, it is important to be evaluated by a doctor or physical therapist. There is nothing wrong with needing extra help. Sometimes the issue is more than simple irritation, and it is better to know that early. Final encouragement. As we wrap up, I want you to remember something important. Your shoulder is not failing you. Very often, it is not broken. It is simply irritated, imbalanced, or not getting the right kind of support. When you create a little more space, rebuild gentle strength, and improve support from the right muscles, the shoulder often starts to feel safer and more comfortable again. So take it slow, listen to what your body is telling you, and do not force movement that clearly does not feel right. For many adults over 60, this kind of steady, gentle approach can make everyday tasks feel easier again over time, whether that is reaching into a cabinet, getting dressed, washing your hair, or sleeping with less discomfort. And if you made it this far, I would really like to hear from you. Which test matched your shoulder pain the most? Was it the side lift pinch, the empty can, or the outward turn? Leave it in the comments below. That will also help me know what kind of shoulder video to make next. Thanks for watching, and I will see you in the next video.